Once again, welcome everyone to this Saturday morning our Saturday morning training, Top Shelf Neutral. My name is Simon Lee, and I'm not going to be the presenter, but I'm going to introduce a gentleman that's no stranger to us all. He's going to introduce our presenter today, and he always gives us a wealth of information. So without further ado, I'll turn it over to Mr. Todd Smith. Mr. Smith, are you there?
I'm here, Simon. Thank you so much for handling the introductions. How are you this morning?
Glad to be here.
I appreciate you, and I'm glad to be here as well. Excited for all of our guests and attendees today. Hello, Top Shelf Nutra family. Just love the opportunity to get together. I'm grateful for the technology that makes it possible for us to connect on a Saturday morning wherever you are. It's great that we have this opportunity. Well, I don't want to take a lot of time in the intro here because we've got a great presenter who's going to be sharing with us. I want to make sure that his camera and microphone are working. So I want to reach out really quick to Dr. Antonio Phillips. Are you there, Dr. Phillips?
Yes, can you see and hear me clearly?
I sure can. Fantastic. I'm so glad we can. How are you this morning, Doctor?
Fantastic, fantastic. I'm ready to get rocking and rolling. Welcome,
Excellent.
everyone.
Well, before we get into some of the information that you've prepared, and I might interrupt you a couple times with some questions as well as we go along. You know how we roll, Dr. Phillips. But I wanted to give a little background, if we could, on you and your career and your education. And so I haven't actually heard all of this, and so I'm doing it for my own benefit as well, Dr. Phillips. Share with us a little bit, because you are an MD, a medical doctor. Share with us a little bit about your education, your residency, your practice. Share with us kind of some background of what got you to where you are.
Sure, thanks, Todd, for first off allowing me to have this platform this morning. I appreciate you for all that you've done. We've known each other for many, many years, and you are a friend. You've always been there whenever I had a question, a comment, a concern, and I really appreciate that. And I've gained a wealth of knowledge from just being in your presence. So thank you. All
You're
right.
very kind. Thank you, doctor. And we're excited to hear from you today. So tell us how you got to where you are.
Well, long when I was a young boy, I said, you know what, I want to be a doctor. And I originally wanted to be an attorney, but I realized they had too much reading and writing. I didn't want to be bothered with that. So, but I really did gravitate towards medicine for a number of other reasons that I won't get all into. Uh, and, when I was thinking initially about medicine back in the 80s and early 90s, as I was getting ready for medical school, there was MD, which is medical doctor, and then there's also DO, which is doctor of osteopathic medicine. And I've always gravitated towards DO, the way they're training and the philosophy is the whole body is being treated um, for, for whatever ailment that you have going on. It's not just a medication. But at that I was younger and I thought, well, MD's got a little bit more back at that time clout. So I said I'll go the MD route. And then as I went to undergraduate, I went to Prairie View A&M University, which is HBCU outside of Houston, Texas. And I had the opportunity to go to medical school at the Ohio State University College of Medicine. And after my training there, I stayed at the Ohio State University and started family medicine residency there. One of the things that you had to do as a resident your senior year is to do a, a research project. And my research project was actually on complementary and alternative medicine. Uh, and, I chose that because that's truly where my heart has always been, even back when I thought about being an MD versus a DO. Moving forward, I have two practices. One is a traditional family practice that I'm employed. So I have an employer who wants you to do Western medicine as far as, and we are graded on, are the patients with certain disease processes getting this medication and that medication and all of those things that, Western world says you have to have. If they have this diagnosis, they must be on this and they must be on that. So actually, I'm graded whether how well I stick to that. I also have another practice that's a weight loss, health, and wellness um, practice where, I see people for, weight loss and wellness options. And I have a lot more flexibility in that realm because I am my own boss. I have my own malpractice for that. So I'm not hindered by what, I do at my 9 to 5 when I'm, working for the man, for lack of a better word. So, this is just where I am. And I spend a lot of time uh, talking about some of the things I'll talk about now, not only with both practices, but I go into more detail at my private practice because it just allows me more latitude to discuss some things that may not be uh, uh, taken as nice in my main practice. So.
Well, that was wonderful background. I didn't know all of that. I appreciate you sharing some of those details with us, Dr. Phillips, because as you say, we've known each other for years, but it takes a formal sitting like this for you to have a chance to tell me all your medical background. So thank you. But share with us a little bit also on your personal life and your family. Tell us kind of what's going on with your family.
Okay. My wife and I, we have 5 boys. We thought we would like to have had a girl, but if we'd have gone that route, we probably would have ended up with 8 boys. Does that sound familiar, Don? Just the flip reverse, but we're blessed. They are all young men, very uh you know, we've had the ability that they're God fearing first and foremost, which, we that is truly a blessing. And, my wife and I, we just really are on this journey to be healthier, not just with ourselves, but also with our kids. And, in this whole realm, I really have to say, my wife has really been the spearhead in all of this. I remember when I used to go to the grocery store and I used to coupon clipper and I'd get bags and bags of stuff for a little bit of money with all these coupons. And then my wife started going to Whole Foods, and I was like, we spent how much for this one bag? And so and so that was just the start. And through this process of over the years, we're educating ourselves and we have really leaned towards more natural, organic as much as possible because we do know that all of the things that are in our foods and our water and our drink does affect our health. And I have on my slide, at the, well, I'll just say it now. And I always tell my patients this: prevention beats treatment any day. It can be the best of the treatment in the whole world. But if you can prevent certain things, then that's really the key to better health. Because you just don't even have to deal with all of the ups and downs and side effects and this, that, or the other.
Fantastic. 5 boys. I love it. I love it, love it, love it. So, this is a great transition here, Dr. Phillips, because I know that you've prepared some material, and the title of that presentation we put out there was 8 things to improve your overall health. And so we want to get into those 8 things. You've got me very, very interested and curious what 8 you chose. So I'm excited to hear from you, and I thank you for taking a little bit of time to introduce yourself and your family to us. But let's go ahead and get into this. But I also, hope that at the end we have a chance for you to give out some of the information about your private practice and things like that as well. So I'm going to pass this over to you, Dr. Phillips. Thank you so much.
You're welcome. Can you can you see my screen?
We see your slides. Yes.
Yes. All right. Well, once again, like I said, I do appreciate this opportunity to to share some information. And I just really wanted to start with the basics because there's so many people who um, some of this information might be brand new to them. And I don't think so much with this particular audience, but it is something that um, I do have discussion with, and even the people as you talk with other people and you talk about their health, some of these things that we may know, they may not know. And so I just wanted to get a good foundation about these 8 practices that I talk about every single day with my patients. Okay. All right. Okay. The basics, taking care of the body. And when I talk to my patients, I say there's 8 things that really make a difference. Do you eat healthy? Do you exercise regularly? Do you not smoke? Or you only drink in moderation? Do you get your rest? How do you handle stress? Do you drink enough water? And do you provide any additional supplements for what you may be lacking in your uh, dietary regimen, that whatever you choose? So that's really the foundation, and it touches on a lot of areas. And so we're going to just go ahead and get started with the Directory Guidelines for Americans. This is something that the U.S. government puts out. This is their latest issue, 2020, 2025. And I gathered some of the information pertaining to eating through this resource. However, I do go beyond what this resource says, but it's a nice guide to get things started. So when we're talking about eating healthy, get this out my way. All right, cool. So I tell people, you have to follow this healthy dietary program. And it really starts when we're born. And we found evidence that if the mom has, even before we're born, if the mom has certain conditions and things like that, that's actually passed on. Her health is passed on to her newborn in the womb. And so this is really, but on this, for the sake of this talk, it really talks about from 12 months throughout your adulthood, how following a healthy dietary pattern can really improve your lifespan if you're meeting your nutritional needs, and so nutrition is a key. And I like this very last part, and it says, and reduce the risk of chronic disease. And I know this is something that we talk about a lot with Top Shelf Nutra, reducing the risk of chronic disease. So as we go on, I tell my patients ask me a lot of questions. Well, what should I do this and should I do that? And should I do this? And I tell them that what I am concerned with is the person that's in front of me. And I almost really do this little diagram to show that my focus is on them. There are guidelines, but they are not absolute. We are all individuals, and each of us have, uh, based on our age, race, health status, all have different dietary needs. And I think I think you've used the analogy, Mr. Smith, in the past where, there's a formulation for small dogs, medium dogs, and large dogs. Well, there's a basic guideline, but then it's narrowed down into for that specific entity. And with people, I look at all of these things because if you're a certain ethnicity, you eat a certain way. And so having that discussion that's focused on how you eat and the foods you choose really makes a difference. Hold on. There we go. One question I wanted to ask is that do most people realize what nutrient dense foods are? And I think a lot of people do not. They may say, well, I go to McDonald's and I get French fries with my meal, or I get a salad there with my meal. I didn't want to say McDonald's, but any fast food establishment, I should say. and I get these certain things. I get a little bit of lettuce on my hamburger, or one thing of tomato on my hamburger. But when we're talking about nutrient dense foods, these are foods that are high in nutrients but relatively low in calories. These nutrient dense foods contains vitamins, minerals, complex carbohydrates, lean protein, and healthy fats. They have little, no added sugar, saturated fat, and I can't see the bottom of my slides. But you can, and so I think it's. But I talk to people about that because many times people don't realize, they think just because they're eating that they're eating healthy. And, there's a difference between the quality of the food that you get and how nutritious it is for you. And I think on one of, I know this is mentioned with, uh, blanking over. Oh, I noticed mentioned on some other shows where they talk about Yuka, which is an app, and I do use that app, and I recommend it to other patients just to kind of get a snapshot of, what is it that what is in the food that they're purchasing at the grocery store, and it's a free app, and I know that it's been on the huddle calls before. Terrence and Monique have discussed that, but I regularly tell my patients the importance of just getting that app, and that'll help you with some of your food choices that you purchase at the store. And another thing I always tell patients, I don't shop in the middle of the grocery store. Staying on the ends is going to be where your healthier options are when you're looking at your produce, your vegetables, whatever meats you choose. If you eat meat, fish, and then your frozen foods, if you like frozen vegetables, are a good option if you don't have the time to prepare those type of healthier nutrient dense foods. So one of the things that you got to look at the core, and when you're looking at some of the core, the vegetables. I have patients, and I ask, well, when was the last time that you had a vegetable? And all too often, many of them said, well, I don't eat vegetables. I don't like vegetables. I don't know if I try to educate them on the importance of having regular vegetables. And if your budget can afford organic as much as possible, we talk about pesticides and herbicides and all the things that are added to our foods. And so when you have the option and you have the means to choose a organic option that is preferred. Now, initially when I spoke about Whole Foods, this was several years ago, but now you can go to a lot of other grocery chains and get organic products at a reasonable price. So, I just want to uh, really encourage that for people, just to minimize those herbicides and pesticides that we know can be cause bad outcomes and inflammation and chronic disease with some of those products that are in some of the foods that are grown. Fruits are another big item, and I really focus on the fruits that are lower in carbohydrates, like your berries, like your strawberries, raspberries, blueberries, blackberries, your cantaloupe, things of those natures that are excellent source of fiber, nutrition, and minerals, but do not have a lot of sugar in it. But I will tell you, I'd rather you have a plum or a peach versus a Krispy Kreme donut any day, because you are getting some of those other nutrients that you do need. And I do speak about grains. I don't speak a lot about grains as far as, but when you are going to have grains, make sure they're whole grains. And that's really the key, because whole grains have soluble fiber. They help delay the gastric emptying, so it makes you feel full longer, along with having those vitamins and minerals, as opposed to the grains that are more simple in context. I also talk about dairy, but I really don't spend a lot of time on yogurt because you really have to be mindful with yogurt that you see in the grocery store because a lot of it has a lot of sugar, artificial stuff, and so that's when that app like Yuka really comes into play. Um, and for those who are lactose intolerant, there are other options that are fortified that are beneficial. And of course, your protein, your meats, your poultry, your eggs. I know Mr. Todd, Mr. Smith, you had just spoke about eggs and how the cholesterol, the yolk is very beneficial. And you talked about some of those studies. We're not getting into that now, but they are available for people to look at. I do a lot of seafood as far as um, not farm raised so much, but more wild caught. And of course, beans and lentils and things like that. And when we cook using your oils, your extra virgin olive oils, those are very, very important because I think what people think, oh, fats are bad, but we have to remember half of our cells, there's the water soluble layer and the fat soluble layer. And so we need those fats, good fats, but we do need those fats for our everyday function. One thing that if mothers may know this more, but when you have a child and they say, well, we don't really start restricting their fats until they're 2, well, why do they recommend that? Because as a child is growing, their brain is growing, and your brain is gray matter, but it also has white matter. And what is white matter? White matter is that fatty layer that acts as an insulation for all of your nerve processes. So when you have a thought and it has to go to your hands or any type of interaction, you need not only your gray matter neurons, which is your brain, but you need that white matter to insulate that signal, that pulse, so that there is no disruption. And as we found out, one disease that's rapidly growing that Mr. Smith has spoke about many times is, Alzheimer's. And one of the diagnostic tests that they use is an MRI of the brain. And when they do the MRI of the brain, what do they see? They see these plaques, these demyelinated plaques. And those are patches where there's no white matter. There's no of those fatty layers. And so, fats that we consume, the good fats are very important and very beneficial for our body. Also talk about, beverages that are added with high sugars, uh, saturated fats, and things like that, how we want to limit those, alcoholic beverages. We really want to use less than 10% of our calories per day coming from these added sugars. Avoid foods and beverages with added sugars for those younger than 2 years of age. I have patients, unfortunately, or even when I'm driving, about around town, you see young children with a bottle. And what's in the bottle? It's some watered flavored beverage or juices. I don't think I really say juices, but it's a lot of it's watered flavored beverage or even soda. I'm like, okay, but those added sugars lead to a mountain of inflammation, which increases our risk of a lot of unwanted chronic disease. The saturated fats, there's the saturated and fats that we really want to stay away from. Those are the ones that are bad for us. Those are not the good fats. When we talk about sodium, it's so important to minimize our sodium. And I also tell people that what we want to use is replace the sodium, which is a positive ion, to potassium, which is much friendlier and more acceptable in the body. And it is used in the same way. But if we could just switch the sodium content and minimize that and add more potassium, That's why they have some of those salt substitutes. And of course, just using things in your cooking that does not add any additional sugars, fats, or sodium. A big thing that I talk to people about also is, alcohol intake. By itself, in moderation, where men can drink 2 drinks or less a day, and a female is 1 drink or less a day. And because there are benefits to red wine and some of those things, and they are fine. It's just when we have excessive amounts, then that really becomes detrimental to the body. I had a new patient at my weight loss health and wellness center that I saw Wednesday. He's over 400 pounds. He said, Doc, I eat very little. He told me how his day goes, what he does eat. And I said, you're right. You do eat a minimal, a small amount. You're not getting a lot of calories from what you're eating. But when I reviewed his social history, which talks about smoking and drinking and those other things, I noticed he drinks he's put on 4 beers a day. And then, of course, on the weekends when he's with his friends and maybe, might be watching a game or two, he has more drinks at that time. And I said, well, you're drinking a lot of your calories are coming from your alcohol intake. And a lot of times we say a little bit, but we don't always put maybe the truth in when we fill out some forms, because we don't want to be perceived as, oh, wow, the doctor must think I'm really a bad person or something. But I don't know if that's the truth. But for him just to even put 4 drinks a day and then to admit to drinking more on the weekends, and that's a whole nother conversation. And one thing that tailoring this journey with him is that I said, let's, and he has a regular doctor that he sees. And I said, well, let's reduce, from 4 drinks a day to just 3. Let's start there. He said, oh, no problem. I can do that. I said, sure. Well, then I'm going to hold you to it, because next time I'm going to say, if you down to 3 drinks, and then guess what? We're going to continue to inch that down further and further. And as he goes through this process, and as he continues and sticks with the process, he's going to realize he's going to feel a lot better and save a lot more money, and kind of hopefully prevent some of the chronic issues that can come from just his lifestyle up to this point. Uh, we talk about overweight and obesity. We do know that obesity is a disease, and the staggering numbers, it's just continued to rise when we're talking about the amount of overweight and obesity in the American society, and even as it's very prevalent in our children. And a lot of that has to do with just our choices that we choose when we choose to eat. And convenience, fast food is very convenient. And if you're a single mom, or even a dual income household, but you're struggling, you know those dollar menus look pretty good. That $5 pizza look pretty good. But we still have to be mindful of the food that we're eating. Is it nutrient dense? In other words, really providing what we need, because we know that we're getting a lot of unwanted calories through some of the food choices that we do make. One thing I talk about a lot is exercise, physical activity. This is from the American Heart Association. They do recommend at least 30 minutes of moderate intensity exercise 5 days a week, where you have a total of 150 minutes or more. Or you can do the 25 minutes of vigorous aerobic activity at least 3 days a week, to give you at least 75 minutes throughout that week. And I have patients who say, yes, doctor, I run, I do this and I do that. And I'm like, that's excellent. But what they also recommend, if you see that is that you need some moderate, high intensity strength training. and I talk to my females in particular, and in addition to my males, but I said it's great that you can run away, but can you punch your way out of a plastic bag or out of a paper bag? Um, and that's when that muscle strength comes into play. And it's more than just helping you with your overall health. You know, that skeletal muscle is there if you have a fall or injury, it's there to prevent, you know, your muscles. I'm sorry, it's there to prevent bone breakage more so than fat. And so this muscle training is going to be very important as far as uh, maintaining muscle strength. As we all get older, we lose uh, we lose muscle density in the sense that we have less and less muscle mass, and so continuing with this physical strength training is going to be very important. Now, I don't expect a 50, 60, 70-year-old to be in the gym using, you know, on the bench press and dumbbells, but there are resistance, universal equipment that is safer. I also talk about resistance bands that people can use. And one thing I do recommend a lot is if patients are unable to go to the gym or can't afford the gym or just don't like the gym, get on YouTube, you know, and there are lots of options there for to get these physical activity that you need. And I say, well, I have a bad knee or I have a bad back. There are lots of YouTube videos out there and I work with my patients to say this is acceptable for you with your current health condition, because we know that if you do nothing, your body is going to waste away as far as its muscle strength and its ability to um, uh, exercise. The more we do nothing, the worse our system gets. And of course, you know, we do know that exercise is important in lowering blood pressure. There's been documented studies on that, and also in that reducing cholesterol. Um, so this is we talked a little about this. We're obviously doing 150 minutes. The taking the option of moving more, sitting less. You know, my job, I definitely sit more than some people who may be in construction or other industries. But I tell people, I said, when you're at home and you're talking to your friend or your family on the phone, you can walk. You can walk and talk, you know, and I do that a lot. Those are things that you can do to increase your physical activity, even when you're not even thinking about it at that point in time, because you're just having a conversation. And also stress the importance of adding intensity. So whether you're able to do it longer, increase the resistance, or you know, whatever. If you are able to use weights, that really adds a lot to your overall health. And my patients that actually do some of these things, they admit to feeling better because of physical activity makes you feel better. How many of us have actually said, you know, I don't feel like working out, I don't feel like doing this, I don't feel like doing that. I mean, I've done that many a time. But after I go through the process and I do that physical activity, I feel great because you've released those positive endorphins that are really beneficial for you. And when we say, well, what is moderate intensity activities? These are some. Well, they'll raise your heart rate and make you breathe a little faster and feel warmer. Walking, water aerobics, riding a bike, dancing. These are just a few things. But if you want to increase the ante, when you're talking about vigorous activities, now these are activities that make you breathe hard and fast. Like, oh my goodness, I'm running, I'm jogging, or I'm swimming really fast, or uh, I'm walking upstairs, or I'm playing sports, jumping rope, you know, martial arts. Those are things that really are considered as vigorous activities and fall into that second category of at least having 75 minutes a week of that. And then you have your very vigorous activities. Had to get some sport and go. Uh, and so these various vigorous activities, uh, lifting heavy weights, circuit training, sprinting up hills, interval training, running upstairs, and spinning classes. And I will admit, I love spinning when I get an opportunity to go. It is so exhilarating. The music's there, and But if you haven't had a chance to do a spinning class, I would definitely recommend it. They are very, very helpful in maintaining your overall health as far as physical activity. I'm not going to spend much time on, do not smoke. This is one of the things that I speak heavily with my patients. This is another true story from this past week with one of the patients at my um, uh, main practice, where we had a Zoom. It was yesterday, a video conference and when she pulls up her camera, she has you can see cigarette smoke coming up. Mind you, this conversation with this person is she had just been released from the hospital, newly diagnosed with most likely primary lung cancer that has metastasized to her brain, and yet she is smoking. And she goes, I know, Dr. Phillips, you've been talking to me about this, and you're trying to work with me, and I'm going to quit. I said, yeah, I saw that cigarette smoke before when you got on your Zoom. She goes, I know I'm going to do it. Some habits are very, very challenging, even when we know what we should do. And even in the midst of a diagnosis of cancer, or I have patients who have COPD that are on oxygen. They use 24-hour oxygen, but they still continue to smoke, or they still continue to do these unhealthy habits. And so my job is just to gently guide and help them move from this unhealthy state to a healthier state. And it does take time, because if you had 20, 30, 40, 50, 60 years of living a certain lifestyle, that is not going to change just because I'm coming in and saying this. This is something that takes time and dedication, and work on both on the patient's part and also on my part. Okay. Moderate alcohol intake. We talked a little bit about that. 2 drinks or less for men and 1 drink or less for women. And we know that, excessive alcohol intake can lead to a number of these problems that are listed there. Does anyone know what binge drinking, the guidelines for binge drinking is? Because I think sometimes people say, well, I don't drink, but when I'm out with my friends, I'm drinking X amount. Or, the game is on, or, I'm just socially on Friday and Saturday night. But if you don't know, I'm going to next slide. Binge drinking is, when you can have 5 or more alcoholic drinks for males, or 4 or more alcoholic drinks for females. Excuse me. In a certain setting, within a few hours. Excuse me. So, so it's really this pattern of drinking. Say, well, every weekend when I get paid, or when I hang with my friends, I do this. This is a considered binge drinking. These are kind of the guidelines. And binge drinking, does have short-term and long-term effects. Some of the short-term is you binge drinking, you're over the legal limit, you drive home and you get pulled over, then you have some legal consequences for your actions there. Or and sometimes people may do things that they normally wouldn't do, and that can get them into trouble. And it doesn't have to be drinking, it could be fighting or anything like that. So binge drinking and eating on the long term can cause some of those things that I mentioned on the slide before: liver disease, blood pressure issues, congestive heart failure. So we really want to be mindful of what binge drinking, and sometimes having a few drinks on the weekend, can be problematic if people don't know what the guidelines are. And so minimizing that would be beneficial for your overall health. So we did talk about some legal ramifications, and there are some people who that they look back and say, "Oh my gosh, I used to do that, or I have done that." Thank God you're still here because some of the things that did not happen to you, thankfully, did not, by the grace of God. When I talk about sleep, this is one of the most underestimated um, things that people can do to improve their health. Everybody's on the go, 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 go. And I will admit, I am one that is always on the go, go, go. But this is from the National Institutes of Health, and this is the recommendations for newborns, how much sleep they get. And if you have newborns, you're like, wow, they're sleeping all the time, but they seem to be awake every time I'm trying to. You have school-age children, preschool and school-age children, and teens. A lot are involved in extracurricular activities, but the benefit of getting that 9 to 10 hours of sleep is very important for their brain function, for their overall health and growth, and being able to be ready for the next day for all that it has in store for them. In adults, it's recommended 7 to 8 hours a day. I admit I do fall short on that on many occasions, and that's probably the thing that I need to work on the most because we have busy lives, but we can't underestimate the importance of sleep and how it is your body's time to regenerate and repair itself for all of the stuff that has happened that day. And there are lots of people who are chronically fatigued because they do not get enough sleep. And then, of course, there's other diseases that impede our sleep, like sleep apnea. And if you do have that, please speak with your doctor how you can minimize that risk. But prevention is a big treatment because the biggest reason for sleep apnea is the chronic obesity that's in our society today. And there are some structural reasons for sleep apnea, but the majority have to do with our lifestyle and our weight. So, sleep is vital for learning and memory, and the lack of sleep, like I said, impacts our health, safety, and longevity. We don't get enough sleep, with this lifestyle that we live, burning, the candle at both ends. So, and when we talked about some of the long-term consequences, short-term and long-term consequences of inadequate sleep. One thing that I have also learned is that there's been studies that show that when you do not get adequate sleep, that increases your eating. In other words, I'm not sleeping, but guess what? I eat more because as a result of me not getting enough rest. And as a result, you eating more and can potentially increase your risk of the chronic disease of obesity, which has a whole host of problems in itself. And we do know that obesity is a chronic inflammation state that your body is enduring. I have patients who have, they might be in their 30s, 40s, and their numbers look good. Their blood sugars look good. All of their labs come back perfect. But I let them know, I say, that excess weight does catch up to you. And it's something that my new patient that I just spoke about that came on Wednesday that drinks, 4 beers a day. He said something that was very astute. He goes, I'm 40, and he goes, I don't see people my size at 65. And I said, you're right. I said, why do you think that happens? He goes, because they're not here. And I said, exactly. Now, there are different reasons, but when you look at people that are older, they may be tall, but they're still slim in stature. And you see a lot of the, you know, little old ladies and little old men, but you can still be tall, but your physique is still slim in stature. And I said, that's very astute because he realizes if he wants to be there for his friends and family, then he has to make some of these changes that he has been unable to make before coming to see me. Um, you know, short-term lack of sleep affects your mood, judgment. We all heard about hungry and sleepy. It's just like a baby when we need to sleep, we can get a little cranky, and that happens to adults also. All right. Stress. One thing about stress is that there is good stress and bad stress. And we all need stress. And just because you have stress doesn't mean that it's problematic. Normal stress is, I'm getting ready for that race because I'm an athlete. Normal stress is I'm going in this meeting, I'm prepared, but still, or I have to give this talk. And that's normal stress. And it's just really your body's reaction to this challenge or demand. And that's okay. What becomes problematic is when we hold on to stress and that becomes a chronic situation that leads to a host of other things, such as chronic inflammation that affects our gut, our mood, our relationship with other people, our work performance. And we had a big stressor when, we talk about the pandemic, COVID-19. Regardless of which side of the fence you were on, that was a stressor, that extended stressor for some time. So, in coming out of that, people realize that, they need to make some changes, but stress can be positive. It's just, how do you handle stress? But if you're constantly worried, anxious, then you may want to, speak to your healthcare provider about what can be done and some of the things that you can do to minimize that. I definitely believe in prayer, believe in meditation. I believe in mindfulness. I really liked, Jennifer Winder. She had a program on Top Shelf a couple weeks ago, and she talks about mindfulness and how that is so prevalent in so many things that we do and weight loss. And I have started adopting that and letting my patients know, because that is really important, that mindfulness. And if your mind is stressed all the time, that does impact your overall health and well-being. I get this question about water all the time. And I just have this question out here rhetorically: how much water should adults consume in one day? Some people say half your body weight and all that. Well, when we're looking at what has been recommended for the CDC, 15 and a half cups, you're just shy of for males, is just shy of a gallon. And then your 11 and a half cups for women is about 3 quarts. Most people don't drink that amount. And I tell people, if you're thirsty, your body's already telling you that you're dehydrated. And one of the things that I really liked about when we were in the past, we had done challenges, and I still recommend that to on patients, is we have to increase our daily water intake. Soda, juice does not count. Now, coffee and tea does count, and it depends on, obviously, what's in your coffee and your tea. That does make a difference ultimately too. But as far as liquid intake, soda, juices, and things like that do not count. We do have to increase our water intake, because when we think about it, our bodies are basically made up of water. And this slide just kind of shows what does some of the things that water does for you. And if you can see here, obviously saliva for digestion, mucosal membranes, keeping them moist. It's important in the brain to manufacture the hormones and neurotransmitters that the body uses to communicate. Shock absorber. So the list here is it flushes the body waste, mainly in urine. And your urine is sterile that comes out, but your urine should be as light as possible, because that means you're getting you're flushing yourself out adequately. The darker your urine is, that just shows that your body's maintaining, holding on to that waste even longer, waiting for it to be flushed out. And that's why water is also important. It helps lubricate our joint. And it helps us deliver oxygen throughout our body. So water is very important. So that's another thing I tell my patients, do not underestimate the importance of water. We are mostly made up of water. We need water to function at our optimal performance. And the last thing that I add is, is supplementation. And so what is a supplementation? That's the addition of an extra element or amount to something. And why do we do this? We've mentioned, I know Mr. Smith has talked about Senate Document 264 and other information come out that our soil does not have all the nutrients that we need, because ultimately we get our nutrients through the soil. When I talk to my patients, I say, well, when do I need to start it? I'm 30, 40, 50, 60 years old. Well, when I need to start? And the time to start is now with supplementation. And I have called Top Shelf Nutra. A lot of times I spend time with them, extra time. And one thing at my weight loss, health, and wellness office, I'm there for the patient. So whether our conversation is 20 minutes, 40 minutes, or an hour, that's that undivided attention that I give them, as opposed to my traditional practice where I have time slots and I still give my patients undivided attention. I just don't have as much time. But my patients say, well, Dr. Phillips is a little late, because a lot of times I give them that individual time that they need, even at my traditional practice, but I still have to be mindful of time constraints and the other patients. But when I have an opportunity to really discuss and show people how, supplementation can be beneficial, and when you're lacking some of those nutrients that your body needs, and talk to them about the benefits, about decreased inflammation, weight loss, increased energy, and just an overall feeling of improved wellness, they really appreciate and resonate with that. And I tell my patients all the time, and I said this in the very beginning, prevention beats treatment any day. And what I try to outline for my patients is this kind of 8-step process, looking at these different things that impact their overall health. And where do we need to improve so to get you to a place where you'd like to be? Todd, I wanted to be respectful of time. I didn't want to go too long. And I can be a little talkative. I love medicine and helping people and getting them into a better space, whether it's mentally or physically. And so I want to turn it back to you. And I do appreciate this opportunity. And if you have any questions, please feel free.
Well, Dr. Phillips, this information has been next level. So grateful that you have assembled this together. I can tell that this is information you're sharing with people 6 days a week, hour after hour, as you're meeting with people. We feel it. And I'm grateful that this is recorded so that we can go back and review it ourselves. But even more importantly, we can point the people we care about to your information, especially those who can't come see you on a personal basis, right? They're in Utah, they can't get out to your clinic.
Yes.
But I do want everybody to know how to get a hold of you, because you talked about doing teledoc, you talked about being able to be available to people. Do you have your contact details here anywhere on a slide that people can reach you if they have more questions or want to enlist your services?
No, but I will actually put my web address, which has my business mobile number, on my website. It's under construction, but you're still able to get the contact information and be able to email me. So I will put that in the chat right now. It's Penta Healthcare 5. I'm sorry, it's pentahealthcarellc.com. And then it'll have my email, it'll have my business mobile that they can even text me.
And when you say Penta Healthcare, Penta,
yes, Penta, and then healthcare LLC.com. And
okay,
I'm going to send
fantastic.
that right now. And that will have all of the information. Like I said, I'm working with my web developer to update it. But it will have contact. You can email me. You can reach me through the business mobile at pentahealthcarellc.com.
Perfect. And I will put that, um, I'll put that on the, sorry, writing. I'll put that on the notes for the YouTube recording as well so that people can see it because it's not on the slides, so they'll see it on the notes for it. So this has been fantastic, Dr. Phillips. Really, really grateful to you. I can just imagine how valuable you are to these patients that you're meeting with on a daily basis. You shared a number of stories of patients that you've worked with, you know, are currently working with. Do you have one story that stands out where, you know, particularly supplementation and top shelf Nutra was beneficial to them?
Of course, I have this one gentleman that for years I've been working with his blood pressure. And actually, I'm pretty good. I'm not tooting, but I'm pretty good at helping people with their blood pressure. Um, and I said, but you got to try the ginger turmeric muscadine. And so he got some ginger turmeric muscadine. And, next time I saw him a month later, he's kind of like, yeah, doc, you're right. Yeah, it really has helped his blood pressure more so than, some of the other things that we were doing. And so, he was very appreciative to that. I do have another individual that is, he takes the sport and go. And his wife told me that we were at church one day. His wife told me, said, man, my husband really likes that that drink, that sports and go. Now, obviously, he's also taking the ginger turmeric muscadine, the GTM, because I said that is a pack. He goes, okay, what should I take? And I said, you got to take the ginger turmeric muscadine. And I said, which he was. And I said, well, you got to add the sport and go. And he just loves it. He goes, man, it cleans him out. He goes, is there something that makes me like not hungry with that? And I said, not to my knowledge, because my wife also asked me, she goes, when the sporting dough came back and she was drinking, and she goes, is there something? Because when I take it, I don't get as hungry. And so I don't know if there is or isn't, but my friend that his wife said, he has really noticed a change in his been and how his overall health. And I looked at him and I said, man, you look great. He has slimmed down, he's feeling good, he's retired. And when I say retired, he's a young retired. He's in his 50s. I think he's younger than me. So, he definitely wants to spend the time that he has left in a better health state. And he feels it. His wife has noticed it. I have many patients who have used the products, whether it's the oil, and noticing the benefit. If they have a scratch or any type of scar, they love the oil. My staff at my traditional office, it, they want that oil every single day, So I have many patients, family, and coworkers who utilize these products. And the other doctor that's in my traditional practice just said yesterday, he goes, what's in it? He goes, I like the way that the color is. It looks great. He goes, I'm gonna have to try that. I said, yeah, you definitely need to try it. So it starts at one step at a time, and I don't want to take up too much more time, but I do realistically have lots of patients who are utilizing the products and have noticed a benefit, not just in my family, but many people are really gravitating toward what Top Shelf Nutra has. And I love the affordability, the convenience that it offers, and the great price, because I love Costco. And if you can bulk it up like Costco, I'm all in.
Fantastic. Well, Dr. Phillips, thank you. Sincerely, thank you for your information. Thank you for your friendship. Thank you for your endorsement of these products. We love having you as a partner here at Top Shelf Nutra and as one of our MD experts. We really appreciate you. Thanks for taking the time today. I know you're a busy man. We appreciate it. And from all of us here at Top Shelf, we want you to know how grateful we are for you, Dr. Phillips. And I will go ahead and bring this to a close. Thank everybody for being here, and hope that this becomes another tool that we can just share with all those that we care about and help everybody on their journey for better health. Thanks, everybody. Enjoy your Saturday. Thank you again, Dr. Phillips.